Good morning, Martha. How are you doing today?
Good. How are you?
Thank you so much for taking this time to talk to us today, to talk to me today. It's a pleasure to have you. I would like you to tell us a little bit about like yourself, who you are, and also what to do.
Sure. I'm Martha. I run a private practice here in Maine, and I work with school age children via teletherapy. So, just like we're doing right now, this is my day to day. And I also post on social media mostly about stuttering these days, but also about speech language pathology. I've been a speech language pathologist for 3 years, so I'm in my fourth year now. And before that, I was a special ed teacher. So I've been working with children for a while in different capacities. And yeah, and I love working with people who stutter. I think it can be really rewarding. It can be there's also elements of problem solving that I think is really interesting and keeps my job interesting. And I think the clients have been wonderful. So I'm excited to talk with you more about stuttering and speech pathology today.
That's great. Thank you so much. From a speech language pathologist perspective, what do you believe is the best like approach to stuttering and why?
I think the best approach is what the client's goals are based on. So I think keeping in mind, what does the client want to work on? What are their goals? Where do they want to make progress? And then building the approach around that. And usually it ends up being multiple approaches. So maybe it's integrating a counseling piece. Maybe it's working on reducing tension, or maybe it's working on some fluency strategies. But it's usually a combination depending on what the goals are. So the goals really, for me, dictate what we're going to be working on. I always think of Nina Reeves, who is a speech language pathologist. Her and Scott Yaris run stuttering therapy resources, and she always says that the goals are for our clients to be communicating comfortably, confidently, and with a little less effort. So I always channel Nina, and sometimes, usually, the goals end up being around those areas. So the I think the approach usually is dictated by the client, and then we go from there.
And in terms of kids who stutter, how can the parents recognize when their a child has a stutter, and what can they do about that?
So for parents, they want to be monitoring for what we would call atypical disfluencies, which you're familiar with, the repetitions, blocks, prolongations, but also monitoring for any communication avoidance. Is the child not participating? Are they not trying to not say certain words? And so just keeping an eye. I think I always tell parents, go with your gut. If you think something is different or off, just talk to a speech language pathologist. That's our job, is to do consultations. So reach out to us. And in the interim, I think just accepting your child's communication, even whether it's stuttering or not, just encouraging them to communicate with you, making sure you give them your attention. And that way you're promoting positive memories around communication, regardless of what else is going on. So that would be my recommendation, is start there, just affirming, but then also reach out to someone who might have more knowledge, and talk through what to do for your child.
In terms of treating like stuttering, what is the biggest challenge for if you are treating a child, if you are treating a teenager or an adult?
So children, so I've only done pediatrics, so I have to imagine for adults, but I think the biggest difference between children and even teenagers and adults is the parents, right? There's another team member. Usually, if adults are seeking speech therapy, they're seeking it for themselves, they've researched for themselves. But for children, the parents are the ones that have researched, that have connected. And so for early childhood, so like 2 year olds to 6 year olds, a lot of the stuttering therapy will be around coaching the parents. So the parents are really the active participant in the therapy, and the child participates too, but a lot of it is giving advice for the parents. And then as they get a little older, school age, so 6 and older, the child becomes more of the active participant, but the parent is still the one who is modeling acceptance at home, who's connecting the child to other kids who stutter, who is promoting self advocacy, sharing with other family members. So that person becomes really, still is really important through children and through teenagers. They're still living with their parents, and so, and largely the parent is paying for therapy, or parents, or I should say guardians or providers too. And so those team members are really important. Whereas seeing an adult, usually you're working with the adult directly and they have a support system, but they're the main client. So that's a big difference that I can see from my perspective, even though I haven't worked with adults. I'd love to, maybe one day.
Why not? Maybe in the near future, that would be great, probably. And some people who stutter are a little bit like skeptical about the benefits of following speech therapy. What would you like advise them?
I think that skeptical is okay. I think we should all approach providers with some level of skepticism, whether it's speech language pathologists or doctors or physical therapists. I think that everyone has their own style. In graduate school, for when it comes to studying, some therapists have a lot of training, some have less, some are taught with different approaches. And so I would encourage people who are looking for speech language pathologists to interview them as well, and make sure that when they're talking about stuttering, that the way they talk about stuttering resonates with you. Make sure that you feel like you're being listened to, whether it's in the intake or the first session, and make sure that you have common goals, that you know what goals that you're working on, and ask if they haven't provided. Because sometimes some speech therapists have goals, and maybe this has happened for you, where they have goals and they don't share, and the client just kind of shows up every week and just goes through it. And that's not what it's supposed to be about. It's supposed to be more of a team approach. It's supposed to be more supportive and built on the areas that the client needs help with. So I think that the client is in the driver's seat. I think if speech therapy doesn't work for you, I give people permission to not do it. Nobody says that because you stutter, you have to go see a speech language pathologist. It's just a tool in your toolbox. And if you need to take time and take a break, that's okay too. It's for you, or for the clients. And so do what feels best for you. I think too, speech language pathologists are shifting from more of a medical model of stuttering, which would be, stuttering as a disorder, stuttering is something that needs to be fixed, to something more like stuttering is a difference. It's okay to stutter, stuttering is acceptable. And so in the social model, thinking the speech therapist role is more of a support. What do you need help problem solving with? What can I help you self advocate for? What can I help you to do to reduce tension, instead of this is something that needs to be fixed, this isn't acceptable. And I think as time goes on and as more speech therapists start to shift over to the social model, there will be speech therapists for everybody, and just finding someone that fits that model that you're looking for when you look for therapy is will be really important.
How can parents help the kids who have a speech impediment? What is the best way to help them?
I think the easiest thing that parents can do is to just promote acceptance at home. So you just listen, maintain eye contact, celebrate communication, like, oh, you ordered your own dinner, or and not point out the moments that perhaps the child looks upset or frustrated. But I think also if the child comes to them and says, I'm really frustrated about stuttering, validating those emotions. Oh, you feel frustrated. What can we do together to help you feel better? And shifting, it's okay to stutter, so we don't need to change stuttering, but helping them problem solve. How could you feel less frustrated about stuttering? And shifting the perspective that way. I think also a huge thing that parents can do is connect kids who stutter with other kids who stutter. And like you're doing through this model here at the Stuttering Society, there's tons of globally, there's tons of organizations. Here in the US, we have SAY, which is the Stuttering Association of the Young. And there's tons of opportunities for kids to meet other kids. And I think that's a really powerful thing that parents can do at home. I'm trying to think about other things, connecting with family members, letting family members know it's okay. This is how this child talks. And we're happy with it. We're fine with them being themselves. That way, when there's family events, everyone knows this is just how Martha talks, and there's other focuses for family gatherings. So I think those are the biggest things that parents can do.
Yeah, I think you did mention some great points, some really key points that sometimes the parents, they miss those key points, and it becomes so hard for the child, to have to deal with stuttering by themselves, and it's a struggle for both sides. So thank you so much for mentioning this. It's so important. Are there any practical speech exercises that people could try at home, from home?
I think it really depends on what your goals are, right? So if you're trying to reduce like tension when you're communicating, maybe working on mindfulness, so like meditation or positive affirmations. If you're thinking about communicating in a specific space like Starbucks, I love Dr. Chris Constantino was in an article a couple of weeks ago, and he was talking about an exercise where the person who stutters would consider, why shouldn't I stutter in this space? And so thinking about those spaces that are challenging, or that you're reluctant to stutter, and sort of flipping it on its head at home and thinking about, why shouldn't I stutter in this space? Or maybe eventually, what spaces could use some stuttering? What spaces could use, as Nina and Scott say from Stuttering Therapy Resources, what spaces could use some verbal diversity, and go from there. And I think, like we were talking about before, something that someone could do from home is connect with other people who stutter, like through the Stuttering Society, or even through social media, connecting with different organizations. There's people who stutter who have Instagram accounts, there's speech language pathologists. So just following the information and being part of a community from home, I think, is a really powerful exercise. And I know for children, especially, who don't have as much awareness about stuttering, meeting other kids who stutter can be a really life-changing experience for them, and really affirms who they are. And that's something that's easily done from home. So there's three ideas.
Yeah, that's great. And I think also because it's very common, the people who stutter, often they feel they are the only ones. They don't really
Right.
know other people who go through the same thing, so they feel so lonely in their own challenge. So I think it's really good to actually follow other people who stutter as well, and try to get to know other people, and know you're not alone, and there are also other people going through very similar situations as you. So
Yeah. I think the social media is a low stakes way to get involved. If you're nervous about joining a support group or messaging, I think following people on social media is a way to kind of see what their experience is like without having to commit your own. So that's always a good place to start. I like to recommend to parents, like, follow the Stuttering Foundation, see what they're saying about stuttering, see what people who stutter are saying, and start there. And then, if you feel like you want to connect more, then join a support group. But that's just kind of a way to, like, dip your toe in and learn about the community and be affirmed that you're not alone, or you're not the only person experiencing concern about your child. Um, so yeah.
Martha, thank you so much. These are all great tips, great talk, and I'm so grateful that you accepted my invitation to be here today.
Thank you for wanting to talk with me. I'm a speech pathologist in a small state, so I'm appreciative. It's been wonderful.
Thank
All
you.
right.
See you.
Bye. Nice to meet
Bye.
you.